Last week, I was asked to help a lady who had had lip filler injections. 3 hours after having lip filler injected into her lips, she posted this picture on her Facebook page, seeking urgent advice. One of her friends then approached me for help. To make matters worse, the practitioner who carried out the procedure was unapproachable and unhelpful. Is this what we fear the most in the field of dermal filler injections? Was one of the blood vessels blocked by the filler? In this video, I will discuss what happened, what the signs and symptoms are that you should look for if you suspect an obstruction of blood vessels from dermal filler injections, and very importantly, how you can minimize the risk of this happening. While I have sought this lady's permission to use her pictures, let us give her a fictional name anyway, and let us call her Lisa. Dermal fillers alongside Botox injections are the most common non-surgical cosmetic procedures used for facial rejuvenation. Dermal fillers are classified as medical devices and are at present unregulated, meaning that non-medically trained individuals can inject them. This carries an increased risk of complications, some of which could be devastating. In this case specifically, Lisa was not made aware of the background and qualifications of the practitioner. This is yet another problem we have been seeing lately. Some practitioners, predominantly non-medical professionals, offering procedures such as dermal fillers and Botox, deliberately make their career background vague, often with all sorts of embellishments to distract potential customers from the very fact that they are not medical professionals. In my experience, a medical professional always declares their professional qualification, and they usually have a website too. So if you see an Instagram profile which does not specify if they are a nurse, doctor, or dentist, and even more so if they do not have a website, it is likely that the practitioner is not a medical professional. Most complications from dermal fillers, such as redness, swelling, or bruising, are transient and resolve spontaneously within a few hours or days following the treatment. There is, however, one potentially devastating complication associated with dermal filler injections, and that is skin necrosis. Skin necrosis is caused by the injecting needle piercing through a blood vessel into which a small quantity of filler is subsequently injected. This results in a partial or complete obstruction of the vessel, depriving the area of a supply of oxygen, leading to the death of the surrounding tissue. This is a medical emergency because any significant delay in restoring the blood flow will result in permanent tissue death. Before we discuss how you can best minimize the risk of complications associated with dermal filler injections, I would like to make you aware of some of the most common signs and symptoms you should look for if you suspect an occlusion of blood vessels after your filler injection. Crucially, you must seek urgent advice from your practitioner if you have any concerns regarding your treatment. The first sign to look for is persistent pain at the injection site. This can be rather difficult to rely on because it is not uncommon that the treated area remains tender after the procedure. Changes in skin color is another diagnostic symptom you should look for. This can present as what we refer to as blanching. The affected area looks rather pale, or sometimes it can be blotchy or grayish-blue in color, which resembles a bruise. In general, an immediate, severe, and disproportionate pain coupled with an acute onset of skin discoloration, as described earlier, are indications of a possible occlusion in one of the arteries. On the other hand, an occlusion in one of the veins may be associated with less severe, dull, or delayed pain. In some cases, there may be no pain at all. These skin color changes may be immediate or up to 3 to 4 hours after the treatment. As you can appreciate, there are no clear-cut signs or symptoms which can definitively indicate that a blood vessel is blocked. The attending practitioner needs to have a high index of suspicion and clinical experience to make a sound judgment. Let us now turn to my number one tip on minimizing the risk of terrible complications associated with dermal filler injections. That is, pay attention on the credentials of the practitioner you are planning to approach. If you take a look at some of these Instagram profiles, do you really want to have your treatment carried out by someone who does not even want you to know their name or exact location? Have you any idea whether you will be visiting a beauty salon, a proper clinic, or someone's conservatory? Do you really want to have a medical procedure which can cause irreversible tissue damage administered by someone who only discloses their mobile phone number? Think about it this way. You will not want to buy a bicycle from someone who does not tell you who they are, where they are, or what they are, and the only form of communication you have with them is their mobile phone number. This brings me to my second piece of advice on reducing the risk of complications caused by filler injections, and that is location. I must emphasize that the location of the practitioner can make a difference between you getting the emergency help you need or not. Due to the lack of regulation, there are many mobile injectors in the UK. This practitioner has clinics across Scotland, and judging from the fact that there is not a physical clinic mentioned in the Instagram profile, it is likely that she rents a room at various beauty or hairdressing salons across the country. Imagine this. You live in Glasgow, you encounter a medical emergency after your filler treatment, like that mentioned in this case study, and your practitioner lives in Aberdeen. It is also quite possible that you will only have the phone number of the beauty salon and the practitioner only visits the salon once in every 4 weeks. Even if you are prepared to travel from Glasgow to Aberdeen, this practitioner does not have a physical facility to see you. Does that mean I do not see patients who travel from outside Glasgow? No, we see many patients who travel from outside Glasgow. That brings me to my third key point for minimizing the risk of irreversible tissue damage after filler injections: reputations. It can be tempting to choose a practitioner based on price, but have you done your homework? Does the practitioner have a permanent clinic? If not, why not? Have you read their online reviews? Is the practitioner a leader in his or her field? How many years have they been practicing in the field of cosmetic medicine? A clinic with an established reputation works hard to maintain their status, and that can be a fairly accurate reflection of their practice's ethos. Closely related to reputation is professional standards. You should think carefully if a practitioner does not have a permanent clinic or can only be contacted via their mobile phone. We have seen on numerous occasions cases where patients are unable to contact their practitioners for help, or the practitioner is reluctant to see the patient in need of help because they are located many hours away in a different corner of the country. We have also seen practitioners who do not have a physical premises and who only divulge their mobile phone number quickly block the patient's Facebook page and mobile phone number when requests for urgent help are made, effectively depriving them of any means of making complaints. In conjunction with this point, it is important that you should always only have your treatment carried out by a medical professional. One overriding responsibility of being a medical professional is that they owe a duty of care to their patients. Refusing to attend to a patient's concern is an offense, which can result in revocation of a clinician's license to practice. It is extremely unlikely that a medical professional will refuse to attend to your concerns, particularly something as urgent as a suspected occlusion of a blood vessel. Furthermore, if a medical professional fails to carry out their clinical duty expediently, you can complain to their regulatory body, such as the General Medical, Nursing, or Dental Council. However, if your treatment is carried out by a mobile injector who is a beautician, hairdresser, or tattoo artist, and they have since blocked your Facebook page and your mobile phone number, you will have very few options left for you to get the help you need. On the subject of getting the help you urgently need, in the event of a complication similar to the one encountered by Lisa, Please always make sure you have your treatment administered by a medical professional who is skilled and experienced. I need to emphasize these two words, skills and experience. As you can see in this picture, there is a complex network of blood vessels in our face. The same applies to our lips because they are some of the most vascular parts of our human anatomy. Some blood vessels are found deeper in the tissues and some more superficially. Injecting dermal filler is more than simply stabbing the needle into the tissue and filling them with fillers. A clinician who has the relevant experience appreciates the intricacy of the facial blood vessel networks and is aware of the key arterial and venous structures that are vulnerable to occlusion. I'm not saying that complications do not happen in the hands of medical professionals. Indeed, they do. However, a clinician who has the appropriate experience in the field is equipped with the knowledge and clinical experience to examine for the telltale signs, make an accurate diagnosis, and will be able to administer the appropriate medical intervention. Time is of the essence in this scenario, and any delay in administering the appropriate medical intervention can result in irreversible damage to the tissue. To sum up, these are the key points you must keep in mind when you are considering having dermal filler injections to minimize the risk of complications, which can be catastrophic and irreversible. Pay attention on the credentials, physical location of the practitioner. Does the practitioner have a permanent clinic? Online and offline reputation of the practitioner. Medical professionals bound by professional standards. Medical professionals bound by their duty of care. Skills and experience of the practitioner. Is the practitioner a clinician? I'm Dr. Kieren Bong, and I'm a cosmetic doctor at Essence Medical Cosmetic Clinic in Glasgow. I have over 12 years of experience in dermal filler and Botox injections, and I have lectured and carried out training masterclasses for doctors, surgeons, and nurses in over 50 countries. Visit my website on www.essencemedical.co.uk for more information.